So the issue was when patients are not eligible for patient assistance programs. Immunotherapies, I will tell you, I have not had any trouble thus far getting these drugs approved. Interestingly enough, I don't think many physicians, at least in the Northeast, are having trouble getting these drugs approved as a second line in which they're approved, or getting them paid or covered, or even in the first line. I think these patients are getting immunotherapy as a first line and getting covered by insurance. I've seen several of these as second opinion. I've had very little out-of-pocket expenses that I've heard about, at least, from my patient population. And there's philanthropy and industry that's certainly helping out. But we've treated a lot of these patients on clinical trial. Of course, we don't have any issue there. But for the patients who've gotten nivolumab or pembrolizumab as standard of care, haven't heard anything from my patients that they've gotten a bill. I mean, that's the real simple question for me. Are you getting a bill? And I think for the most part, we haven't had any trouble with payers covering this. And I think they should. I think these drugs, there's a lot of interest, at least in the media, about the cost of these drugs. There was a Time magazine cover recently about the role of immunotherapy, but interestingly, the cost of immunotherapy. But if you're sitting in my shoes and you see the differences between outcomes, between a patient who's responding to immunotherapy versus a patient who's getting chemotherapy, I think it really speaks volumes. So we haven't had trouble getting it covered thus far. I mean, the first thing, and I know patient assistance programs are through industry, but I would really reach out to industry and find a way. I'm not going to give a patient a drug if they're going to get stuck with a bill. I mean, that's the bottom line. My patients are already strapped enough as they are. It's going to be me or, admittedly, my nurse practitioner getting on the phone to either that industry or other philanthropy to see if we can get the drug approved. It's rare, I'm not speaking to experience. I don't have experience yet with patients not having coverage for this drug. In fact, every immunotherapy that we deliver as standard of care goes through our prior authorization department prior to giving. To my knowledge, we have not had any issue getting these drugs approved. I may be the rare exception, and this may not be indicative of the community or other academic centers, so I can't speak intelligently about what we do in those cases. I will say when we've had problems with targeted therapies, and there have been some very good payer assist programs through the industry that will help, or through philanthropy that will help. So, and we have really good social workers who help out with this.